A PNP is a pediatric nurse practitioner.
We can diagnose, treat, prescribe, just like a doctor would, but with the touch of a nurse.
Kids A to C with the PNPs. T is for teasing and dental care.
Hi everyone, welcome back to Kids A to Z with the PNPs.
Where each week we take a closer look at some of the common health problems affecting our kids.
And we're your hosts. I'm Cortney.
And I'm Dominique.
And what are we talking about?
Today is the letter T, and so we're talking about teething and dental care today.
Yeah, so teething can be a really stressful and exciting time for parents. A baby's first tooth is a big milestone.
Yeah. So baby teeth typically come in between 6 months or start to come in between 6 months and 10 months of age, but can start to come anywhere from 4 to 15 months of age, and all of that is normal.
Mm-hmm. So your child should have about 20 teeth by the time they're 3 years old. Usually the first teeth to come in are the front teeth, and the last teeth to come in are the second molars.
Mm-hmm. So some signs that your child may be teething are sometimes it's associated with fussiness or being more cranky. Your child may be drooling more or chewing on objects. Teething has been associated with a slight increase in temperature, but it doesn't cause a temperature greater than 100.4, and it's not associated with a fever. So if your child does have a fever, they should be, your doctor should look into other causes of what that fever is, not from the teething.
So we can help our children be more comfortable during the teething phase by giving them chilled but not frozen, like teething rings, washcloths. They sell like things the kids can chew on that are cold and feel good on their gums. Mm-hmm. We can also give Tylenol as needed if they're super fussy, or Motrin if your child is 6 months of age or older.
Mm-hmm. You do want to make sure that those teething rings, teething devices are all just one piece to avoid risk of choking. And also it's not recommended the teething necklaces, which I think they're like amber. Mm-hmm. Necklaces or bracelets. They actually, are a risk for strangulation and also choking hazard as well.
Yeah, and actually recent studies have shown that they actually don't really do much. Mm-hmm. So let's take a minute to talk about like the topical pain relievers for teething, like Oragel, I think it's called. So Oragel, they do still sell it over the counter. It has been, it can be unsafe. So we actually don't recommend teething tablets, any kinds of these like topical gels. It can cause excessive sleepiness. It can cause
trouble breathing.
It can even lead to death if taken inappropriately. Also, I hate to dog on grandma because I feel like we've dogged on grandma before, but grandma will recommend like rubbing a little whiskey on the child's gums. This is not a good idea for, I think, obvious reasons.
Mm-hmm. And it is important to note that these medications or topical things are still sold at CVS and your local pharmacies. Again, you can buy without a prescription, but we do not recommend giving them. So kids start to lose their baby teeth around 6 years of age, and that's when the adult or the permanent teeth come in. It's also the time that the tooth fairy shows up, and I heard that she leaves better treats and gifts if you draw her a picture or write her a note.
Stop. I'll let my kids know that. So dental care should begin when your child erupts, their first tooth erupts. So getting your baby used to the toothbrush, so you want to make sure that you use a toothbrush that's soft bristled and that's designed for infants. At first you can just use water. It's really just getting them used to having the toothbrush in their mouth.
Mm-hmm. And doing, brushing their gums or their couple teeth at night before bed.
Yeah, just once a day at night before bed when they're infants.
The American Academy of Pediatric Dentistry actually recommends seeing a dentist at the time the first tooth erupts or no later than the first birthday. Mm-hmm. So this may seem early to go see a dentist, but it's really to get your child used to being at the dentist, and provides a lot of education for parents, how to keep the mouth healthy and happy in preparation for more teeth to come in.
Yeah, and just like, there are family doctors and there are pediatricians, there are also family dentists and pediatric dentists. So it's up to you where you want to take your child, but pediatric dentists, they do have, more, a few more years of training, and they specialize in children. So let's talk about toothpaste for a second, because they do sell like training toothpastes, which are safe for kids and babies. These don't actually contain fluoride, but you can just put a small amount, like the size of a grain of rice, on your infant's toothbrush and use that. And it's really just to get them used to the idea of toothpaste and the flavor. And then around the age of 18 months, you can start adding like a toothpaste with fluoride. You'll initially start out with just a like the size of a grain of rice on their toothbrush, and then once they reach about the age of 2, it'll be about a pea size of toothpaste. You just don't want to give your child too much toothpaste that they could end up swallowing.
And this small amount is still okay for them to swallow as they're learning how to brush and spit out their toothpaste. So really supervising your child until they can reliably brush their teeth on their own and spit out their toothpaste is a good thing parents should be doing, probably until they're about 6 years old.
About 6, yeah.
So some other tips for just maintaining good oral health for our kids is, for our infants, we never want to put them to bed with a bottle of milk. That milk can sit in the nipple, and the sugar of it, sits on the gums, sits on the teeth, and can cause a tooth decay, or what we call bottle rot. Really only offering, if you are to offer juice, it should be given with meals. Otherwise, only water or milk in between meals.
Yeah, and you can actually start introducing a sippy cup to kids around the age of 6 months to get them used to it. Whether or not they'll be, really great at it is another story, but you can start introducing them to the sippy cup, and you really want to try to wean off the bottle entirely by the age of 12 months.
Flossing is an important part of good oral health, and it can begin as soon as 2 teeth are touching each other. So that's usually around 2.5 years of age. Obviously, children are going to need some help with this, probably up until they're 10 years old. But there are flossing devices that can make it a little bit easier for children.
So your child should be having regular dental visits twice a year for cleaning and checkups. If you would like to be referred to a pediatric dentist, you can always give us a call, 313-745-KIDS. We'll put that up on the screen there, and we'd be happy to help you.
That wraps up everything with tea. If you guys have any questions, comments, drop them below. Give us an email at kidsatz@dmc.org. And next week, we are talking about the letter U.
And U is for UTIs, or urinary tract infections. So we will see you then.
Thanks for watching.